Thank you so very much for the care you have given to me. I have never had an operation or stayed in a hospital, but I doubt many places have the level of hospitality as Fatima. You have truly made my stay warm and comfortable. When we receive letters from our patients after they've been discharged, it makes me feel really good to know that we've delivered on our promise of providing patient family-centered care.
We started using the principles that we talked about, the family-centered principles as our philosophy of care, and the plain tree model as our environment of care, and our relationship-based care model as our care delivery model. Since then, we've enhanced those elements to include a change of shift rounds between staff in the room with the patient and family.
It's an opportunity to form a partnership between the patients, their families, the surgeons, and the nursing staff. We work together, we make rounds together.
What a great, powerful statement for the physician and the nurse to come into the room with the patient and say, how are you doing today? Here's the plan for the day. We're all working around as a team together. Here's our communication. What else can we help you with? It again sets a message that we're here for you.
The rooms are very spacious. We encourage the families to stay and participate in the care, which makes the transition upon discharge a lot easier because the families are intimately involved in the care of the patient.
That works out really well. The families come and go as they please, and we interact quite a bit with them. They seem to be very happy with it also.
Nurses used to ask the families to leave the room when they were going to either do anything or talk to the patient. Now they welcome the family to be there because sometimes the family knows more about the patient than even the patient does.
Those rounds have become so popular with the use of a whiteboard on the wall to identify, here's our care goal for this shift. And it could be my care goal as a clinician could be I need to walk you down that hall twice tonight. But as a patient goal, they could say, I would really love to have my hair washed. And we agreed that those are our goals for this evening.
Teamwork is a big thing. We all work together. The nurses, the aides, there's no your patient, my patient. We're all there for the same reason.
The patient satisfaction is in the 99th percentile. We find as a result of this unit we have better outcomes, shorter hospital stays. It's great that now we hear patients coming to our offices saying, you go to Fatima Hospital, I want to be in Care 1.
We are thanking the patient for allowing us to care for them at the end of our shift, which was an idea from the nurses. They finished their shift saying, thank you for letting me care for you today. That's a really powerful statement. And then here's your new nurse who's going to do a great job between now and the next time we see each other. Those rounds at the bedside are so valuable in terms of engaging the patient and family in their care, as well as transitioning between care providers so the patient doesn't feel lost.
And the patients just love it. And when they're leaving, I discharge them and I say goodbye to them, and you kind of develop the relationship with them, and they say, this is the best place I've ever stayed at. When I leave here, I'm telling everybody. And that's a great feeling. That means we're all doing our job, we're meeting our goal, and we're meeting patient satisfaction. And that makes me as a nurse feel good about my job.